Hi, I am Dileep Mavalankar, Director of Indian Institute of Public Health, Gandhinagar. I want to talk to you about a very interesting new study, which is a randomized controlled trial which has been conducted in Spain on effect of vitamin D on outcome of COVID-19 patients. This trial has been done at the University of Regina Sofia in Spain by Dr. Martha Castillo and her group. This is a very interesting small study of 76 COVID-19 patients who were hospitalized in the university hospital in Spain. They were randomized in two groups. One group received one form of vitamin D, cholecalciferol, and second group received no special treatment or the regular treatment provided in that university. After follow-up, these COVID patients which were randomized in two groups showed very different outcomes. The group which was allocated through randomization COVID treatment had 50 patients in that group, and their outcome was much better. They showed only 2% of cases which deteriorated and were admitted to ICU, whereas the group which was randomized to receive no special treatment or regular treatment had 26 COVID-19 patients, and out of them almost half, which is 13 patients, required intensive care unit treatment. Thus, the difference between the vitamin D group and not receiving vitamin D group was statistically highly significant. Besides the admission to ICU, the other outcome which they checked was mortality. In the vitamin D group, out of 50 patients, there was no death, whereas in the control group, where there were 26 patients, there were 2 deaths. Thus, there was also difference in the mortality outcome of these two groups. Of course, this was a randomized but small trial, and hence this group calls it a pilot study. Seeing these encouraging results, the group is now taking up a much larger study, a randomized control trial of vitamin D. And in the full paper, they have also provided the biochemical support of why vitamin D would reduce COVID intensity and its mortality. So in short, they have shown that at least there is a ray of hope by using vitamin D in COVID patients. Vitamin D is quite cheap, easily available, and already widely used substance, and hence future trials would be much more feasible, easy and low cost, and hence the research agencies should fund such future trials to see whether these small pilot randomized control trial can be shown to be effective on a larger scale. Thank you very much. Please read the full paper when you get a chance. Thanks.